eyelid inflammation, blepharitis, dry eye, ocular rosacea. These are our common disorders that are often overlooked or underdiagnosed. And I think the reason for that is we really haven't had good treatment options until recently. We can take care of this very quickly, predictably with Clearadex. And 80 to 90% of the time, within a few weeks, patients' symptoms of redness, burning, irritation will resolve with daily Clearadex use. Millions of people in the United States have chronic dry eye symptoms, eyelid inflammation, ocular rosacea, or conjunctivitis that is recurrent. And now we've got a product, Clearadex, that allows very good success in a very short period of time, and is also safe enough to use long-term for long-term success. Millions of people in the United States have blepharitis or eyelid inflammation. And I tell patients that when I see them and they have symptoms of burning, itching, redness, fluctuations in vision, giddiness, that these are very common things that I see every day in dozens of people every week. And patients, once they understand that this is a common problem and that it's a treatable problem, they become excited because they've never been told that, boy, if we treat your eyelid, your eyes are going to feel better, you're going to look better, you're going to potentially see better, because these conditions are often overlooked or ignored. And the reason for that is we've not had good treatment solutions until recently. Clearadex allows us to confidently treat these patients, tell them that within a few weeks we can typically reverse their symptoms, and it's something that's safe and effective for long-term use. Clearadex works much differently than other products that are out there. It is not a detergent or a soap. It is a natural cleansing agent based on the properties of tea tree oil. This allows it to be preservative-free and allows a patient to use this for the rest of their life. And it gives results very quickly. And we've never had a product that has effectiveness in a short period of time that also can be used long-term. So Clearadex has provided a long-term solution for these patients. Clearadex is a natural tea tree oil-based product that is successful at treating patients with dry eyes, blepharitis, or eyelid inflammation, as well as ocular rosacea. And it does this in a way that is natural, no preservatives, and is very successful long-term. The product typically will give you results within a couple weeks. Patients will have reduced burning, reduced itching, their eyes will be less red, and in many cases their vision will actually improve after we've treated their disorder. If a patient has dry eye symptoms, eyelid inflammation, or blepharitis, ocular rosacea, or even conjunctivitis, Clearadex is highly effective at resolving their signs and symptoms within just a few weeks. Most patients that I've treated with Clearadex have had their symptoms for a long time. They've seen other eye care providers, they've tried over-the-counter treatments, they've tried prescription treatments, and they've, in many cases, developed some mild depression as a result of just having chronically irritated eyes, red eyes. They maybe are not as confident in a social situation. And when we treat their problem, we see them come in with a smile on their face, and we see more confidence, and we know that we can have long-term results with Clearadex. Over the past few years, I've concentrated much of my time in practice to treating people with chronic ocular surface disorders, chronic eyelid inflammation, blepharitis, dry eye, ocular rosacea. And the reason I like doing this is because we've got very good solutions like Clearadex now that can give patients success, relieve their symptoms that we didn't have before. 10 years ago, we didn't like to see these patients as much because we didn't have much we could do for them. Now that we have a product like Clearadex, we can actually help them. That's very rewarding for myself as an optometrist. Clearadex is something that I recommend on a daily basis for my patients, and I tell them that it works quickly, and I have had hundreds of patients with very similar symptoms that we've treated with Clearadex, and typically those symptoms resolve within a few weeks. Clearadex is easy for me to recommend to my colleagues in optometry as well as ophthalmology. And the reason I can do that is because I've treated over 300 patients with eyelid inflammation with Clearadex over the past 2 years. And 80 to 90% of the time with the product, we can get the patient to have reduction in their symptoms within just a few weeks. So I can confidently speak to my colleagues based on my track record of success with the product.